Welcome back to another episode of the Sahara podcast. In this episode, we're going to be talking about hospitalizations. Specifically, we're going to be talking about how to prevent hospitalizations. But here at Sahara Home Care, our focus is, home care in general's focus is to try and keep our clients in the home. So we do the best that we can to prevent them going to the hospital or needing to be outside of the home. So without further ado, let me introduce you to our guests in this episode.
Hi everyone, I'm Dr. Naseem Fatima. I'm a family medicine physician. We recently moved from California. It's almost about 1 year now. Currently, I'm a medical director at Pilsen Medical Clinic, which is in Hillside. And here, our providers go to patients' houses and provide outpatient care for the patients. And we're working on building outpatient clinic at the Hillside location right now, and I'm happy to be here.
We're happy to have you. So my first question for you would be, what are some of the most common reasons why seniors end up in the hospital?
Name a few of the common conditions why elderly get admitted into the hospital. Heart disease, including heart failure, heart attacks, stroke, COPD, it's chronic obstructive pulmonary disease. Mm-hmm. It's a lung condition. And infections, from viral infections like COVID-19 infection, complications, flu, bacterial infections, which can cause things like cellulitis, which is a skin infection, to pneumonia, which is a lung infection, and falls. Falls are pretty one of the common causes why elderly get admitted. Falls can lead to hip fractures, so that's also one of the common things. These are to name a few.
Mm-hmm. And then I know that you're mentioning all these infections and stuff. Something that I do know and that we, educate our caregivers about is that the older an individual gets, the more susceptible they are also to getting all these infections, and which is why it's so important to make sure that their space is clean, and to make sure that, our caregivers, if they're not feeling well, to, let their supervisor know, maybe not go and visit the client, to make sure that they're not, that's one way to prevent, I think, hospitalization.
That is absolutely right.
And then fall prevention is huge, which is something that we'll talk more about. Yeah. So then, talking about all of these reasons why a senior might end up in the hospital, which of these would you say are the most preventable, like that we can prevent right at home?
Yeah, great question. So most of our chronic conditions, right? For example, if you're talking about heart disease, stroke, right? They're usually the result of chronic conditions like obesity, high blood pressure, smoking, diabetes, kind of lead to this path or contribute to it, right? So preventing these conditions or controlling these conditions can prevent, in turn, the admission or the disease itself. So that would, exercise, lifestyle, healthy lifestyle, medication, medications, being compliant with the medications, and are common things in terms of preventing these chronic conditions like heart disease and stroke. Now, if you're talking about COPD, which is a lung condition, smoking, avoiding smoking if possible, or getting help to quit smoking. Alcohol intake. Alcohol intake is a big factor which can contribute to multiple diseases. Abstinence or limiting. And then if you're talking about falls, we will talk a lot about falls because we can do a lot to prevent falls. And then infections, like you were mentioning earlier, if if somebody's sick, trying to avoid contact if possible. If not, hand washing, the infection control measures, mask when it's appropriate, vaccination, being on top of your vaccination can reduce these infections, and just monitoring your blood pressure and weights if you have heart failure, and if you're feeling warm or chilly, checking the temperature, if there is any rashes or checking that, if that could be a source of infection. Does that answer your question?
Yeah, it does.
Okay.
So like just kind of being more proactive about and observant, I think, of things and reporting them. So I know you touched on this a little bit, but what would you say are some red flags that, caregivers can be on the look for in their clients that might indicate a serious problem?
Yeah. So I mean, if the patient is able to communicate their symptoms, right? So they will tell you that they are not feeling well, or it burns when they urinate, or there is a rash, or they're short of breath, they have a chest pain, they can communicate. Now, it gets harder when you're taking care of a patient who is unable to communicate their symptoms, for whether if they have dementia or, whatever other reason that they're not able to communicate their needs. That's when it becomes really important to monitor them even more closely. In those scenarios, it can be change in their mental status. They appear to be more confused. They just don't appear to be themselves. They appear to be short of breath, checking an O2 sat, O2 sat, I'm sorry, that's like oxygen saturation, checking that to see if they have low oxygen in the blood, or if they are, unconscious, not arousable. Those are some obvious, red flags. If they appear to be more than, really fatigued, very fatigued, and if they have fever, if they feel warm, checking the temperature, anything more than 100.4 degrees Fahrenheit is fever. And getting a good exam done, especially in terms of people who cannot communicate their needs. They can have a rash, or skin infection, or lung infection.
Which is, going based off of what you said, which is why we push our caregivers to report everything to the supervisor. So if you notice anything off about your client, because like you mentioned, they're not always able to communicate what they're feeling, what they're experiencing. So I think for our caregivers, it's really important that they're observant and mindful of these things, and they're letting their supervisor know, so that they can, tackle it before it becomes a serious issue. So now talking more about fall prevention, because that's something that our caregivers are trained to do and something that they need to be mindful for. So how important would you say fall prevention is, and what are some ways that the caregivers can help with this at home with their clients?
I love this question. Falls, to give an idea, right? I mean, 1 in 4 adults experience fall every year. So that's a huge number, right?
Wow, yeah.
1 in 4 every year, right? Now, there can be a lot of factors which can contribute to the fall, right? Let's talk about patient-related factors first. So, vision. If their vision is impaired, right, then they can fall because they can't see and they can trip, right? And if they feel imbalance, if they are dizzy, people who have neuropathy or certain conditions, they have problems with balance, and that can cause falls. Now, heart problems. If you have a rhythm problem of the heart, then you can pass out and you're falling like that because there is rhythm problem of the heart, certain rhythm problems. These are some of the medical conditions that we kind of make sure that patient does not have in terms of fall cause. Another thing I would add is blood pressure. If the blood pressure is going too low, then they can fall as well. Actually, one more thing. If the sugar goes too low, I mean, if they are diabetic, right, and they're on insulin, and if the sugar goes too low, then they can pass out. So we can put this in the nutshell of maybe metabolic abnormalities, right? So low glucose, certain other electrolytes abnormalities can make you fall, pass out. Heart problems, imbalance, neurological problems, vision problems. Okay, so these are patient-related factors which can make you fall. Now let's talk about environmental factors, right? That's very important as well. So let's start with maybe stairs. Okay, so stairs. Few things that we can do, to prevent the falls, like having lights at the beginning of the staircase, having lights at the end of the staircase, so that it's well lit. Then if there's carpet, if there's better to avoid carpet as much as possible, rugs, because you can slip and you can fall. And if you are having rug, right, then it's better to have some non-slip backing on the rug.
They sell those,
Yes, because that, if you want to absolutely have it. I personally would not want my patients to have it, but if you absolutely want to have it, then something non-slip to, get that factor, avoid that factor. So back to the staircase, lights, carpet, if there are any areas on the carpet, on the stairs, which was loose or torn, needs to be taken care of, because your foot can go in there and you can fall. And, predominantly in environmental factors, I'll not repeat myself over and over again, making sure there are no objects on the, clear of the objects in any of these areas that we're going to talk about, because that's, again, something that can happen and something that is easily preventable, And then, so that's about the staircase. And let's talk about floor. We kind of briefly spoke about it, the floor being clear, rugs, and if we move to the kitchen, maybe having things that a patient uses all the time on the lower cabinets than in the higher cabinets, because that will prevent them using any kind of stools, step stool, and then prevent the fall in that way. And again, light is also very important. Having good lighting where the patient is living, it's key. Let's move to the bedroom. In the bedroom, having a light which is reachable whatever side you're sleeping to, which is easily reachable from that side. I mean, nowadays we have these, you can press a button and the light will turn on. We have all these nice things.
I've seen like people clap.
Yeah, exactly. I mean, if you can do that, that's great. But if not, at least, whatever we can do, having accessible lighting. And then very important is to have the pathway which leads from your bed to the bathroom to be lit. So having those night lights, obviously you don't want to have a light on in the room when you're sleeping, because that'll affect your sleep, right? But having a night light, which only, there's this motion detector night lights, which when you step, then it'll light up, and then there'll be a path for you to go to the bathroom, and you will not, less chances of falling. And then we spoke about kitchen, bathroom. Let's go to the bathroom. In the bathroom, right, the shower area or the bathtubs, having, again, non-slip mats. Non-slip mats, because these are some little things that we don't pay attention to, but they matter, so having those non-slip mats, shower, bathtub, if you need help in terms of, getting up and transferring, if there is any need, then those grab bars can really help. Having those in the shower, bath, and, even, they can, on the toilet seat as well, you can have these grab bars which can help. One thing that I forgot to mention for stairs is that having those handrails.
Yeah.
Not only on one side, but both sides handrails can also, even if somebody is like falling, they'll have something to grab, you know. And so these are like the environmental factors which can really help prevent fall.
Mm-hmm. Yeah, and like hearing you talk about it, you know, I think that the environmental factors play a huge role, because even if someone are more likely to fall because of, you know, an illness that they have or their vision issue or whatever, if there's things around their environment that they can hold on to, that they can grab to, it'll prevent them from getting seriously injured to the point where they have to be hospitalized. Yeah.
Yeah, that sounds right.
So caregivers that are providing in-home care are not medical professionals. So it's very important that they don't ever give any medical advice. They also cannot, you know, administer medication to the clients. They can remind them to take their medications.
Okay.
So it becomes a little tricky. How can our caregivers monitor these vital signs and, you know, do all this without being a medical personnel, without doing it, without crossing that line of, you know, not being a medical professional?
Yeah, so they do help the patient in many ways, you know, doing the chores around the house for them. That, you know, that has a huge, you know, one thing off their plate, and you know, help with showers and personal care. So, and help with, you know, even picking the medications if that needs to be done. So that's great. What they can definitely do is remind the patient, you know, if they have high blood pressure or they have heart failure, then reminding the patient to check the blood pressure and maybe noting it down for the patient, you know, because it's good to have a log when they go to their provider, because then the provider can look at the readings and can, you know, discuss the plan with the patient and remind them about the weights if they have heart failure, reminding them to take their medications. You know, a lot of times that they forget taking their medications. So that can be of huge help. And they really know when they are taking care of the patient like that. They really know when the patient is, you know, not acting themselves, or so because they are seeing them in and out, day in and out. So that makes a huge difference. Yeah.
So then, one thing that we always push our caregivers to do is communicate everything with their supervisor. So, you know, noticing nothing is too small to report. You know, it's better to be safe than sorry. So, you know, being observant of their client, and like you said, they're with them every day. Yeah. So they know them best. A lot of times they know them better than their own family members know them, because they're
at work and everybody is, you know, everybody does their own thing.
Exactly.
So,
they're the ones that are with them all the time. So which is why it's so important for our caregivers to report everything back to the supervisor, so that, you know, and the supervisors can also give them ideas, like how you're giving these great ideas on how they can, you know, help their client without pushing that boundary of being a medical professional, because we're not medical professionals.
I'm very happy to hear that they have that. They're told that it's okay, you know, just let us know. It's not, let us know, we want to hear. Because sometimes people, even if they see something, they might be afraid if they don't have that environment that, hey, you know what, it's okay to bring up anything, you know, we're here to hear and we'll take care of it. So I'm glad you guys provide that.
Yeah. It's really important because it is a tricky situation, you know, like how I mentioned, we're not medical professionals, so our caregivers may and do sometimes feel that there isn't too much that they can do, but of course they want to help because they have that connection with the client. They're taking care of them. They're doing all of these close personal things for them, personal care. You know, they're doing their housekeeping. They're also there for companionship. So they're just there to talk. So they of course will build these relationships, and it can be difficult for them. So that's something that they can do, you know, is to make sure that they're actively letting us know. So then we can kind of guide them too on what they can do, you know, about it. Or we can communicate it to the client's case manager, and then the case manager can, you know, because it becomes tricky, like I said, because we're not medical staff. But yeah.
Okay.
And then kind of going back to talking about fall prevention in the home and, putting like lights and whatnot on the staircase to help prevent them from falling. Each of our clients have a very individualized plan of care, and our caregivers are, made aware and informed of medical conditions that their client may have. So just being aware of those things is really important, I think.
Yes.
And if you're aware about it, if you educate yourself about, the diseases that their client is experiencing, what that can look like. I think that also, if they're not able to afford like putting handrails or, in situations where they're in a low income home or living with extended family, I think being mindful of those things, since they're with them, at least when they're with them, they can pay attention to, oh, they seem like they're a little dizzy, maybe they didn't eat, or little things like that, if they can't afford having, just to add on to
of course.
ways to prevent
or
them falling.
if they don't have that, and if there is help available, then that person can help from when they're going down the stairs. Just kind of keep an eye that there's no guardrails and we cannot provide that, so maybe let's just do this.
Or like just move the things out of the way. As you mentioned. So then why is it so important for them to remind the client to take their medication, in terms of preventing them going to the hospital, going to the emergency room? How can taking their medication help prevent that?
Yes. I'm passionate about medications in patients for many reasons. Let's first talk about preventing the hospital admission by taking your medications. Now, for example, if they have heart failure, COPD, high blood pressure, diabetes, any of these chronic conditions where their prescriber has prescribed the medications for the patients. Missing the medication dosages or not taking as prescribed can exacerbate their condition, why it was prescribed in the first place. So if when there is a flare-up, then they can get admitted to the hospital. It's not, every time you miss a medication, I don't mean that you will get admitted to the hospital.
Right.
I just mean that it's sometimes, if you're chronically missing like that, or in certain conditions, like missing a couple of doses of your diuretic in heart failure can end you up in the hospital if that's something that you always need. So it is very important, taking medications, and that can be helped by, reminders. I tell my patients to put reminders by someone reminding them, by having pill boxes, that will kind of organize it for them. So in many ways, but medication adherence and missing the medications and having hospital admissions, it's huge. It's huge. And to add to that, not just missing the medications, but if you're seeing multiple specialists, right? If you're seeing a primary care provider or you're seeing your specialist, sometimes specialists will do a change. Ideally, we should be all aware of what changes are being done. But sometimes that doesn't happen. The EMR is not integrated, and the primary care does not know that the specialist did the change, and that primary care has prescribed a particular medication, the same medication, or a different medication, but there is interaction towards the medication. So I really, I can't emphasize it enough. I tell all my patients all the time that, take in charge of your medication list, have an accurate list with you all the time. And whenever you're going to different providers, take that list with you. And, a provider can prescribe a medication saying, hey, take it 3 times a day. But the patient might not be taking it 3 times a day, might be only taking twice a day, for whatever reason. Maybe they experience a side effect, maybe they just they felt nauseous due to that, or they, so conveying that to the provider is also important, and so that everybody's on the same page. And when we do if you're adding another medication on top of that, suppose the blood pressure is not under control, right? if I have prescribed something twice a day and the patient is taking it only once a day, if I just know that the patient is taking only once a day instead of twice a day, instead of adding another medication, I'll just emphasize that, hey, you know what, let's just do it like this. Take it twice a day instead of, unless you want me to add another one. And a lot of people don't want more pills, right?
Course. Yeah, they have side effects.
But sometimes they feel afraid to say that, hey, you know what, the doctor told me, but I'm not taking it. So they're hesitant to kind of mention that to the physician and the team, but it is important that they know and everybody's on the same page. There is no judging in terms of patient care. The whole goal is that the patient care is the best and they're taken care of. I'm sorry, I'm just kind of, I am very passionate about the medications because it can prevent a lot of unnecessary complications.
Of course.
And save everyone a lot of time and energy.
Of course, of course. And even our number one priority, is the client at the end of the day and their health. And we want to see our clients thrive. We want to see them happy. It makes our work easier as well. And of course, it's better for our caregivers that have this close relationship with them, so then they don't have to, go through watching their client decline or watching them go through all this, especially if it's something that's preventable. And then going back to kind of how you were saying that, clients might be, or patients might be hesitant to say that, hey, I'm supposed to be taking my medication, but I'm not. But it's because of this fear of being judged. And this is something that's really ingrained in our society, which it shouldn't be that way. And it's refreshing to see, a doctor that thinks this way, because a lot of times, body language is huge also, and tone is huge. And if the patient doesn't feel, or the client doesn't feel like they can tell their doctor anything, or can tell their caregiver even anything without being judged or without having to feel that attitude, then they won't express things, and then that ends up worsening their conditions. So
100%.
Definitely, definitely transparency is huge.
Yes. And
I agree.
No judgment. It's about the care. It's about the patient care and the best possible care we can do. And it's a teamwork. It's not it's not just like the patient or the doctor. It's the medical assistant, the patient's family, the care you guys provide. If there's home health involved, them. So it's a whole team.
And everyone needs to work with one another, which is also important. I know how you were mentioning that, a lot of times the primary care might not know that if they went to a specialist, if the specialist was giving them what medication, how much medication, which is why it's so important to report everything to document everything.
Yes.
Which is something we push for our supervisors to do too. Anything that your caregiver is telling you, anything that the client tells you, make sure you're documenting it, you're making a case note of it. And our caregivers reporting everything to their supervisors. It's important for our supervisors to create, that safe space for their caregivers and for their clients, that they can come to their supervisor with these things. Because
it's amazing.
It's definitely. And I think everyone should, how do I say this?
Take responsibility.
Exactly.
Take responsibility and take ownership.
Take ownership, exactly. Anyone within the chain of care. Because you don't know, like, for example, if you're hesitating and thinking that, oh, I'm just their caregiver, like they have a primary care. I'm sure their primary care is going to take care of it. Like, I'm not going to say this one thing because why do I need to say it? I'm just the caregiver. But at the end of the day, you don't know. What if the primary care forgot to note that down, or it was something that they didn't observe, or the client didn't say it at their appointment.
And the primary care provider is not seeing the patient for as long and as often like the caregiver is seeing the patient, or the family knows the patient. So it's truly a holistic care and a team-based approach.
Definitely. So we talked about medication, we talked about fall prevention. Now let's talk a little bit about nutrition and hydration. So how can, being on top of their nutrition and hydration, both the client themselves and the caregivers that are preparing meals for them, what role does that play in preventing hospitalization?
Yeah, that's another wonderful question. So, nutrition is key. I mean, we're talking about normal adult, right? Now, if they have high blood pressure, then salt intake needs to be, reduced, less than 3 grams, certain scenarios less than 2 grams per day. But we're talking about, certain conditions like heart conditions or certain conditions when your provider tells you there is fluid restriction that you need to abide by. So, you got to follow per your providers, your primary care providers' recommendations. But a general view, if you're talking about that, then it is a well-balanced diet. A well-balanced diet, having lots and lots of fresh fruits and vegetables in the diet. 4 to 5 servings, if possible, per day of vegetable or fruit. And we can do that by maybe with each meal having a fresh fruit or vegetable and 2 snacks as fresh fruit or vegetable. Whole foods, whole foods, minimizing processed foods, ultra processed foods as much as we can, and having fish, fish twice a week if possible. If you are not a vegetarian, it can increase the omega-3 fatty acids, and that's good. It's good for your body. Reducing the red meat in the diet, increasing legumes in the diet, and
can you explain a little bit what legumes are?
Yeah, so like lentils. Lentils, So different kinds of lentils, beans, mixing it up, try different kinds, and having that. It's a great source of protein, plant-based protein, and yogurt. Yogurt is good. Nuts. Nuts are good for, you get antioxidants, fresh fruits, vegetables, whole food, limiting the processed foods. And hydration is very important. So, on an average adult, 8 to 10 glasses of water a day, 10-ounce glasses. So, about 2.5 to 3 liters of water intake per day for an average adult without other medical conditions that we discussed. Yes. And water, we're not talking about sweetened beverages here. We're not talking about, sodas and
H2O.
H2O. Because even the store-bought juices, no matter how much they market it as being real, they have a lot of added sugars.
You'll see like a little asterisk too. It'll be like made with real fruit. Asterisk. And then you see the little asterisk. It's like, actually, it's not made from.
No, it'll say that there are traces. The traces of the real food, and there's like sweetened
1% of real fruit in the
makes me so mad.
Yeah, definitely.
But juices. I mean, obviously you can do that, but making it at home and
it's better to do that.
Natural ways of sugar. Like dates, honey, if you're using the sugar, and going from there. Yeah, and I can talk about this topic all the time too. So let me stop right there.
So then, talking specifically about infections that are common in the elderly. For example, if we talk about UTIs. Are there any indications that caregivers can be mindful of or observant of in their clients that might indicate that they might be having a UTI, especially if they can't communicate, as we mentioned?
Yeah, exactly. So you're right on point. If they can communicate, they can tell us that they're having, they're urinating more than normal, or they had burns when they urinate, or even after urination, they still feel like they need to use the restroom. They can say that. They can say they have pain in their lower belly. But if they can't communicate, right, and at that time, they can be subtle changes, like the patient is not acting like themselves. And I don't mean that anytime they don't act like themselves, they have UTI.
They have a UTI, right.
I do not absolutely mean that.
Right.
It is possible that when they have UTI, they can present it like this. So it's,
Right.
they're not,
Right.
I don't want to, that's not, I don't mean that at all.
Right.
So it can present in their as altered mental status, which is not, acting like themselves or some confusion. They can, when they might groan, and moan if they can't really communicate at all, when they're urinating.
Right.
And maybe they'll not eat, their appetite will go down. They will not eat. In elderly, unless, if they get fever, that means it is, serious, because they may not mount fever for every infection they have too.
Okay.
So it can, being mindful of that, and if they feel warm, checking the temperature, and 100.4 Fahrenheit or more is a fever.
Yeah.
So basically, being confused, not being themselves, moaning or groaning when urination, or not eating, or if they have fever.
Yeah.
Can be some things that can signal infection.
And then again, going back to how we're not medical professionals, I know you already said this, but I didn't want to reiterate it for our caregivers that might be watching. Just because they are moaning or groaning or something along those lines, not acting like themselves, it doesn't mean that they have an infection or they're, need to go to the emergency room, or you need to call 911. But being mindful of these things is important, as you mentioned, and just let your supervisor know. Tell your supervisor if you notice that something's off, and then, let your supervisor tell you what to do from that point, or advise you on how to move forward. Definitely. So then kind of going back to that point, how can our clients and their caregivers distinguish when they should be calling a doctor versus when they should be going directly to the ER?
Yeah, it's a tricky question.
Yeah.
So there's no straight answer to that. Certain things, right? Like if they're unconscious, they're not arousable, right? That's obviously 911, going to the ER. If they are having stroke symptoms in terms of sudden one-sided weakness or numbness of the body, if they're having sudden slurred speech, if they have sudden vision changes in terms of blurring of vision, that they say, hey, I can't see from one side at all. Those are some, and to add to that, maybe the sudden chest pain or pressure can point towards heart attack. But that can, if you have chest pain, based on the severity, if you're really short of breath, that you can't talk in full sentences, or, you really look in distress, maybe the stroke symptoms, being really short of breath and not being able to talk, unconscious, to name a few that for sure go to ER. But if not, most of the things, chest pain is a severe pressure, chest pain, elderly, heart attack is something that we need to rule out, and, time is very important in those scenarios. So ER. But if it is, can always call the doctor's office and see what they say, because they can triage, and it is very it is very symptom specific, and your provider knows all your history, so they can direct you. They can say, hey, you know what, it's okay, come in. Even if they have chest pain, they might be like, hey, you know what, I know you, come in, I'll evaluate you, right? Or they'll be like, no, this chest pain sounds serious, I need you to go to the ER. So, reaching out to your provider is a good first step, unless some of the obvious things that I just mentioned.
So it's a very case specific. I would say. Yeah. And we do provide training to our caregivers, on when they should be calling 911 and what to look out for. So, definitely. Okay, so we've talked a lot about things that can be done in the home to prevent hospitalizations. Are there any community resources that are out there for the elderly or for, our caregivers
Yeah.
based on this? Yeah.
Yeah. So if the patient is completely independent in terms of doing all their activities, then there are these local senior centers, where they something to look into, availability in terms of social gathering to, like playing bingo, or there are some exercise sessions that they do that can be really, nice for the patient. Besides that, gyms, physical therapy for fall prevention is there's a specific kind of physical therapy for fall prevention, which will help you with gait training, functional training. That can be very useful. In terms of patients who need help with their daily activities, home care, home care services, something that you guys provide. And there are, other home care services as well, and home health. But home health is more so the physician will determine if the patient
it's more medical.
Needs it, and how long the patient needs it for. But if they need help, home care is definitely a good resource that the patients can use.
So to kind of close off this episode, this session, what would you say is one key takeaway for our caregivers in preventing hospitalizations for their clients?
Okay. Don't be afraid. Do what you can to help the patient. If you feel like there is something off, report it. Can help them by certain things we discussed in terms of environmental factors for fall prevention. You can help the patients by reminding them in terms of taking medications, and helping them doing their blood pressure checks, weight checks, if it is medically indicated. If you don't know what to do, reach out to your supervisor and get help. Thank you for everything you guys do.
Oh, thank you so much. And from hearing you talk, we can see that you are a doctor that really cares about your patients, and sadly that's something that's hard to see nowadays, I would say. Not everyone is in it for the sake of caring for others. A lot of times it's money, greed, other things come into play. So it's refreshing to see someone who seems to be genuinely passionate about what they do.
Happy to be here.
Yeah, thank you
for the opportunity.
Thank you. And thank you to all of those that are watching. Once again, I'm going to reiterate one more time, you're not medical personnel, so it's very important to just be in communication with your supervisor and let them know of things that you notice, especially changes in your client's behavior and environmental factors in their home. Just be in communication with your supervisor. Once again, thank you so much for coming out, and we'll see you in the next episode.